Hi everyone, today we will be doing a presentation on cerebral vascular accidents or strokes by Heather Lee and Sierra Beck. And a cerebral vascular accident is the sudden death of some brain cells due to lack of oxygen and where the blood flow to the brain is impaired or restricted by a blockage or rupture of the artery. And it's also commonly referred to as a stroke.
So some of the risk factors of strokes is, first off, age. It says in the book that anyone could experience a stroke, but it's normally those over 60 years of age or older. It also mentions online by the Stroke Association's website that race, African Americans have a higher chance, and with sex, women have higher risk and death rate with strokes. And then also it mentions something called prior strokes or TIAs, and it explains that if you have TIAs, you have a higher chance, and also if you've had a heart attack before.
There are two main types of strokes. One of them is an ischemic stroke, which is formed by a clot, and then there's two different types of clots that can form a stroke. And a cerebral thrombosis is a clot that develops in part of the brain vessel, and so the clot forms in the brain, and a cerebral embolism is where the clot forms somewhere else, typically in the neck or the heart, and then it travels to the brain and clots that. And then a hemorrhagic stroke is a bleeding stroke where the weakened blood vessel ruptures and it bleeds into the area surrounding the brain, causing pressure in the blood in that part.
And also the other one that we mentioned earlier, which is a TIA, it's called a transient ischemic attack, and it's known as a mini stroke to most people, but what they said online is it should be called a warning stroke, since it's when a clot is experienced along with stroke symptoms for about 5 minutes, then subsides with no lasting damage. They really highly mention that these should not be ignored, that they're a really good sign that a stroke, a higher chance of a bigger stroke is coming. And so one of the things they had online was how to spot a stroke, and that's what this little picture is. You can't really see the words, but the F stands for face drooping. The A is for arm weakness, and the S is for speech difficulty, and T is for time to call 911. So these are kind of like an easy way to remember. And then Sierra found a really good video online that's about strokes, and so we're just going to play that real quick.
First of all, we'd like people to recognize that a stroke is a true medical emergency. And as soon as you feel like you have any symptoms that may be a stroke, to seek medical attention as soon as you can. Preferably call 911 so that they can bring you to the emergency department and get acute care. A stroke is a disease that affects the arteries of the brain. There are two types of strokes. Approximately 10 to 15% of people have a hemorrhagic stroke, which the artery actually bursts and you have bleeding around the brain. The other 85 to 90%, it's called an ischemic stroke, which means the blood vessel is blocked off by a blood clot and the artery can't supply the oxygen and the tissue nutrients it needs to the brain, and that part of the brain actually dies. What we really like to impress upon people is that signs and symptoms of a stroke a lot of times are quite vague. And so if you feel like you have any symptoms at all, we'd like you to seek medical attention. We'd much rather have you come to the emergency department and have it not be a big problem than to sit at home and have a stroke. The signs and symptoms of a stroke are severe headache, dizziness, lightheadedness, weakness of any kind, trouble seeing, trouble speaking, slurred speech, weakness or numbness and tingling in one arm or one leg, or both arms or leg on one side for the most part, drooping of the face. Sometimes a sign of a stroke is just passing out or fainting. The major risk factors for a stroke are a strong family history, high blood pressure, high cholesterol, diabetes, smoking, excessive alcohol intake, as well as obesity. You want rapid treatment for a stroke. Much like a heart attack, we say time is muscle. Well, with a stroke, time is brain tissue. And therefore, the sooner after you begin having symptoms you get to emergency department, preferably a certified stroke center, the better for your treatment to start. When you arrive in the emergency department, there are protocols that we use at our certified stroke centers. We immediately evaluate you with the National Institutes of Health stroke scale. We also do lab work, CAT scan of the brain, and then we know if we're ready to do some treatment. We need to have you here within 4.5 hours of the beginning of your stroke symptoms if it is an ischemic stroke, and we can use medicine called TPA. That's the clot-busting drug we've used for years with heart attacks, but now we're using it with strokes, and it has shown to be greatly successful. We also use aspirin or some other blood thinners in different circumstances. But the key is to get in as soon as you can and to begin the treatment.
Okay, so the next part is about hemiplegia, and that is when it's a one-sided weakness that affects about 8 out of 10 stroke survivors, causing weakness or the inability to move one side of the body. And so with stroke victims, pretty often they'll have to figure out if they had left hemiplegia or right. And with left, there's visual neglect or a lack of vision on the side of the body opposite of the brain lesion, so opposite of where the brain was affected by either blood or a rupture. And then it talks about difficulty with spatial and perceptual tasks and impulsivity, so being careless or doing something right away. And lastly, with left side, they have a hard time being unaware of their deficits. And so for right hemiplegia, they tend to struggle with speech and language deficits, but they can comprehend what is said to them. So speaking is really hard for them, but they can understand. So that's nice to know as TR that they can understand us. We just have to learn understanding them better. Also, they approach newness with caution, so you have to be careful with that. And they're sensitive about having had a stroke.
And in TR, we can interact with those that have had a stroke, mainly if you work in a hospital setting or if in a nursing facility or a rehabilitation facility where someone could have had a stroke. And there's different ways you need to interact and plan activities depending on which side of the brain the stroke affected them. So if they had left side damage, they can overestimate their functioning ability, and so the TRS needs to be aware of that and help them demonstrate their abilities. And they present verbal feedback and arranges tasks where objects are transferred to the right to the left hand to help work with their brain with their damage. And with right side damage, they communicate using concise, specific words that help them understand it better. And they offer frequent feedback and reinforcements to ease the anxiety associated with the tasks. And
these are the resources we used, and there's a lot more online if you ever wonder about activities you can do with stroke victims. Thanks for listening.